Please try to stand on your toes from now on. How is it, standing on your toes? Let's keep this for 10 seconds. Let's go. Good morning. This is YouTube Medical University. This video is something you rarely see in a hospital. We want to share a non-medicinal method, often not taught by hospitals, to help you sleep through the night. We'll also explain in simple terms how to improve, examine, and treat frequent nighttime bathroom visits, a common issue for many. Even when I get on the bus for a trip, I always think about the toilet. I wake up because I want to go to the toilet at night and then I can't sleep and I'm always tired. The toilet thing is always on my mind. It's hard to talk to people about it, and I don't want to rely on medicine. But it's okay now. In this video, I'll explain these troubles from a doctor's perspective to make it easier to understand. As it's a difficult topic to discuss, let's study it together on YouTube. I'll provide detailed information so the video may be lengthy, but I hope you'll watch until the end. I usually work as a general practitioner in Hokkaido and see out patients, but I hear about these troubles at least once a day. Nocturia, or frequent nighttime urination, is a common issue that many people seek consultations for. Some even regret not seeking help sooner. I'm happy to help alleviate these troubles. Today, I'll define nocturia, which is considered abnormal when you wake up multiple times at night to use the toilet. Secondly, I'll discuss the harmful effects of untreated nocturia on the body. Thirdly, I'll explain methods to improve sleep until morning. Finally, I'll talk about seeking medical help. I would like to explain up to the timing. In this channel, we explain in an easy to understand manner the accurate information from the standpoint of an active doctor. We will continue to release useful videos, so if you could subscribe to the channel, I would be really happy. Now, let's start with the definition of nocturia. How many times do you think you have to wake up at night to be called nocturia? Well, I am. Just because you wake up once in the middle of the night doesn't mean you have nocturia, but it's a bit worrying, isn't it? Actually, it is said that even if you wake up to go to the toilet once in the middle of the night, it is called nocturia. There are many people who think that nocturia is just waking up once. Actually, it is said that 1 in 4 people suffer from this nocturia. And what's more, it is said that 1 in 2 people over the age of 50 suffer from nocturia. But just because you wake up once in the middle of the night doesn't necessarily mean you need to be treated. If you wake up in the middle of the night and end up sleeping during the day, or if you're tired or something, many people get diagnosed due to poor sleep, fatigue, and other issues. We primarily consult with these individuals and provide examinations and treatments. Even those who wake up twice during the night, considering it a good night's sleep, experience fatigue or insomnia and report various symptoms. Let me explain the dangers of leaving nocturia untreated. When I considered creating this video, there is a reason why I decided to make this video, but I only wake up once to go to the toilet at night, so I'm not that troubled, right? Can you really say that? Actually, according to some data, people with nocturia have an increased risk of falling and insomnia. Not only that, the risk of falling and getting injured increases when you get up in the middle of the night, and it's said that people who wake up to go to the toilet twice or more at night have twice the risk of fractures compared to those who wake up less than once. It's said that 10% of the reasons why Japanese people need care is due to fractures, so just by ignoring this nocturia, you could be at risk of falling and breaking a bone, and in the worst case, becoming bedridden. This nocturia carries such risks. Even more frightening is that there are reports that people who wake up 2 or more times in the middle of the night due to nocturia have twice the mortality risk compared to those who don't. I don't mean to scare you, but I think it's clear that just ignoring this nocturia can lead to various problems. But that's not all. Many people are unknowingly stressed because they are subconsciously aware of the proximity of the toilet. People who frequently use the restroom, not just at night but also during the day, might avoid going to the cinema altogether.
Some people avoid taking the train because they worry about needing to use the restroom during the journey, unknowingly limiting their own activities.
There are many cases where people end up carrying stress unknowingly. What can be done about it? What should we do? Do you realize how much nocturia is lowering the quality of our lives? Even if you don't have nocturia now, the risk increases as you age. The frequency of nocturia increases with age, so I hope you will learn the methods to improve nocturia that I will introduce later and try to prevent nocturia that may occur in the future. Next, I would like to introduce the third method to improve nocturia so you can sleep soundly until morning. I hope to introduce the method to improve nocturia so you can sleep soundly until morning. The first one is a stretch for the legs. You might wonder if it's really okay to recommend leg stretching to doctors. There is a reason for recommending this. In fact, it is often said in medical practice that leg swelling is the cause of nocturia. What does this mean? When you are busy with housework or work during the day, water tends to accumulate in your legs due to gravity. Have you ever experienced that your legs are heavy at the end of a busy day? That's the reason. Please look at this diagram. During the day, your legs are lower than your heart, so water accumulates in your legs and they swell. However, when you lie down at night, your heart and legs are at the same height, so the water that had accumulated in your legs returns to your heart and circulates throughout your body. As a result, the amount of blood flow increases all at once, and it seems that a lot of urine is produced in the body. That's why you may find the toilet closer at night than during the day. Do you understand? And the important thing to improve this is what we call leg elevation. Why is that? Why the calf, you may ask? The calf is actually referred to as the second heart. What does this mean? Let me explain a bit about the anatomy of the human body. Imagine a thick leg here. Here is the calf. Our bodies circulate blood from the heart through the arteries to the extremities. Then it returns to the heart from the legs through the veins. So how does the blood return to the heart from the legs against gravity? Here is where the valves come into play. These valves are structures inside the blood vessels that allow blood to flow from bottom to top, but they close to prevent the blood from flowing back down due to gravity. This is the role of the valves. It's quite graphic, isn't it? There are valves here. The valves prevent backflow, but that alone is not enough to push the blood upwards against gravity. That's where the calf comes in. When the calf contracts, it squeezes the blood vessels shut. This helps push the blood upwards. That's why the calf is referred to as the second heart of the human body. Therefore, by contracting your calves well before going to bed, you can improve the blood flow in your legs and reduce the number of times you need to go to the bathroom at night. What I recommend is stretching your calves, walking, jogging, or other light exercises. Especially by doing light exercises, you can create a good sense of fatigue in your body and sleep deeper. As for me, I would like to recommend light exercises such as walking. However, it can be difficult to make exercise a habit, so this time I would like to introduce a simple calf training that anyone can do right away. Let's do it all together now. Please try standing on your toes. How is it? Stand on your toes. Keep this for 10 seconds. Let's go. Okay, then please rest for 5 seconds after that. Yes. Then please rest for 5 seconds and then stand on your toes again for 10 seconds. Please try doing this in 3 sets. If it's hard for you to stand on your toes, you can do it in front of a table and hold on to the table. Even just doing this will cause your calves to contract and improve the blood flow in your legs. So there's a high chance that it will improve nocturnal urination. This is a stretching method that you can do while cooking when you're busy or even while working. So I hope everyone will try it. Now, the second method to improve nocturnal urination is to avoid foods that stimulate the bladder. Spices and citrus fruits may stimulate the bladder and make you want to go to the toilet. Therefore, if possible, you might want to avoid eating spicy foods that you usually eat at night. For example, try avoiding kimchi, spicy curry, or citrus fruits if you think they might be causing issues. If sleeping through the night after avoiding these foods resolves the issue, they may be stimulating your bladder and causing nocturia. However, frequent urination can have other causes as well. There are also well-known drinks that can cause frequent urination. I think you all know them. They are alcohol and caffeine. Especially if you drink alcohol as a nightcap, alcohol has a diuretic effect, so you might want to go to the bathroom at night, and alcohol itself can lower the quality of sleep, so you might not want to get up and go to the bathroom, but your sleep is shallow and you wake up and end up going to the bathroom. Alcohol can cause such a situation, so alcohol is a double punch that is bad for night sleep. Try not drinking alcohol before bed and see how deep your sleep is at that time. Alcohol could be the cause, but also be careful with caffeine. If reducing alcohol helps, it's worth trying. Drinking coffee at night can cause insomnia and frequent bathroom visits. Surprisingly, the same caution applies to tea. Green tea, black tea, and even cola contain caffeine. If you drink tea at night, try choosing a decaffeinated option, as it could be causing your frequent urination. Next, let's discuss how to sleep soundly through the night. The third way to improve frequent urination is to eliminate body chill. Have you ever been outside on a cold day and suddenly needed to go to the bathroom so badly that you couldn't hold it in? That's what I'm talking about. Actually, humans have a phenomenon called cold diuresis, where we want to go to the bathroom when we get cold. We have a muscle called the bladder that stores urine. When urine is produced, this bladder muscle relaxes and expands. Then, in turn, the muscle called the urethral sphincter, which is at the exit of the bladder, contracts. That's why our bladder is usually relaxed. The muscle called the urethral sphincter contracts tightly. This prevents urine from coming out, and when the bladder is full of urine, information is transmitted to the brain gradually. It's better to go to the bathroom now, and when you want to go to the bathroom, the bladder contracts and the urethral sphincter relaxes, allowing urine to come out. So what happens when the body is cold, when the body gets cold? In fact, muscles tend to contract and harden. Therefore, the muscles of the bladder can't expand and harden, making it impossible to hold urine, so you'll want to go to the bathroom just to hold it. Such things happen. So if your body temperature cools down while you're sleeping, there's a chance you'll have to urinate frequently. So be careful. Please try to warm up your body before going to bed. It's recommended to take a shower or bath to warm up your body before going to bed. Also, by taking a bath at night, sweating and removing the swelling of your body by draining the body's water, or when the body temperature rises and falls, it is said that human sleep becomes deeper. So by deepening sleep, the number of times you wake up to go to the bathroom at night will decrease. So please take a bath at night, warm up your body, massage your feet, remove the swelling of your feet, and then go to bed. I always do this too. So see you next time until morning. The fourth way to reduce frequent urination is to eliminate the cause of dry throat. The most common reason for nocturnal urination is drinking too much water, often due to lifestyle habits that dry out the throat. A typical example is excessive salt intake, which Japanese people are known for worldwide. Consuming too much salt triggers the body's defense response to dilute the salt, leading to a dry throat and increased water consumption. Consequently, excessive urine is produced, causing nighttime bathroom visits. Even those who think they are okay may be surprisingly unaware of their water intake, so please think you've been tricked. Please check how much water you consume in a day. It's okay to check over 2 days. Just with water, you should be consuming over 1.59 quarts per day. Those who drink too much might not be a problem. If you are one of them, try limiting your water intake a bit and see if the number of times you get up to go to the bathroom at night decreases. Especially taking in too much water at night makes it easier to urinate at night, so it's more important not to take in too much water before going to bed. There's a point to note here. If you don't take in enough water, urine won't be produced at all, so the urinary tract in your body won't be flushed out. And as a result, bacteria that have entered once may not be able to get out with the urine and may stay in, increasing the risk of cystitis. If you get cystitis, your bladder will be stimulated, which may make you feel like going to the bathroom more often. So especially for women who are at risk or those who have had cystitis in the past, it's necessary to be careful not to take in too little water. If you want to learn more about cystitis, check out my previous video in the overview section. Try to improve any mentioned lifestyle habits that apply to you. By trying each one, you'll find something that works for you. You may find a way to improve your nocturia. Finally, let me introduce the timing when you should go to the hospital. This is very important, so I would be happy if you could listen to the end. When is the timing to go to the hospital for nocturia? And if you go, which department should you go to? I will explain such things. The timing to consult a hospital for nocturia is when the symptoms are strong and you are troubled, especially those who are not so troubled until they sleep and the number of urinations is not so many. I think it is good to try the improvement method I just mentioned. However, if nocturia is painful, you can't sleep and it's affecting your daytime work. For those who are suffering like this, I think it's better to improve as soon as possible, so please consult a doctor at the hospital. By the way, if you're wondering which hospital to go to, if you have a regular doctor in internal medicine, I think it's good to consult with that regular doctor. Nocturia is a very common symptom, so I think they will accept the consultation, and if they think it's better to introduce you to a specialist, they will introduce you to an appropriate department such as urology. And if you don't have a regular hospital to go to, I recommend going to the urology department first. If you're scared to go to the hospital thinking, I'm scared, are they going to put a camera in my urethra and examine me? Please rest assured that you won't be forced to undergo such an examination. In most cases, the first thing you'll do is a blood test and an echo test, which doesn't hurt at all. Most of the time, you'll undergo a painless examination. And then, even if you've made the lifestyle improvements I introduced in this video, and your symptoms don't improve at all, please consider consulting a doctor at the hospital. The reason is that many people have nocturia due to an underlying illness in their body. The most important thing not to overlook is the bladder, or prostate, uterus, ovaries, and other tumors or cancers. As I just mentioned, the bladder or the organs such as the prostate, ovaries, and uterus compress on the urinary tract, causing symptoms of frequent urination. And another very common condition in men is prostate enlargement. The prostate is a small organ located just below, and it tends to gradually enlarge as men age. This enlargement can cause the bladder to be compressed, leading to symptoms such as frequent urination, inability to urinate, or a feeling of residual urine after urination. And then there are also diseases that cause frequent urination in women. One of them is called overactive bladder. It's like the bladder is overactive. The bladder becomes sensitive, so you feel like you need to urinate just a little bit. It's a symptom where you end up going to the bathroom. Overactive bladder can be idiopathic, caused by diabetes, or related to the brain and nerves. There are things like that. And what I want to tell everyone is that there are effective treatments for both prostate enlargement and overactive bladder. In fact, many people tell me that they have improved a lot by prescribing medication. If your lifestyle habits do not improve, please consult a hospital. How was it? This time, I introduced a method to improve nocturnal urination, which can keep you asleep until morning, which is rarely taught in hospitals. In summary, to help with frequent urination, here are the key points. I introduce stretches for the back and legs to reduce swelling. Spices, citrus, alcohol, and caffeine might stimulate your bladder. For nocturnal urination, warm up your body's core before sleep. Many unknowingly drink too much water. Count your daily intake. Urinary problems are uncommon. Discussing health with people around you or doctors can be challenging. Videos can provide easy-to-learn information to help you become healthier starting tomorrow. I aim to continue providing helpful information that's easy to grasp. If you enjoyed this video, please like it and subscribe to the channel to stay updated on new content. Your support means a lot to me. Despite the video's length, I greatly appreciate you watching it through to the end. Thank you! Well then, let's meet again in the next video.